Good afternoon, everyone, and welcome to our webinar on eye health, healthy aging for Black older adults. Our presenter today is Dr. Cheryl A. Reynolds. Dr. Reynolds is a graduate of the University of Florida and Nova Southeastern University College of Optometry. She is an associate professor of optometry at Nova Southeastern University College of Optometry and director of the Retina Clinic. Also, she is a fellow in both the American Academy of Optometry and the Optometric Retina Society. Dr. Reynolds served as president of the National Optometric Association, NOA, from 2017 to 2021. She was awarded the NOA's Optometrist of the Year in 2013. She is a recipient of the 2021 Women in Optometry Leadership Award and the American Optometric Association, AOA, for the year of 2021. And she received the President's Award that year. She also is the NOA's liaison to the National Eye Institute, NEI, the National Eye Health Education Program, NEHEP. Thank you so kindly for joining us, Dr. Reynolds, and welcome.
Thank you.
The floor is yours.
Thank you so much for having me. It really is a pleasure to be here to talk for the next 45 minutes or so on eye health. I think it's an important component as we grow up. So I know it says older adults, and I like to use the term grow up because I think that we're still growing up. And one of the key thing in the messaging for this presentation is that as you grow up, as you get older, you don't have to lose your vision. So I hope today that I can present ways that we can save our sights. All right, so we're going to share my screen. Let's see here. All right, so again, this presentation is on eye health, healthy aging for older Black adults or growing up. And again, I'm Dr. Reynolds, immediate past president of the National Optometric Association, also an associate professor at Nova Southeastern University College of Optometry, and I'm proud to be part of the National Eye Health Education Program, NEI, part of their planning group, and also co-chair of a new initiative, Eye Health, My Health, Eye Health for African Americans. And as president of the NOA, I just want to introduce this organization. I'm so proud of this organization. We have been around for over 50 years, really dedicated to advancing the visual health of minority population. And again, as part of the National Eye Institute, National Eye Health Education Program, this was established in 1988 to promote eye health as a public health priority and to prevent vision loss through outreach and education. And I'm proud to be part of NEHAP's planning group and be a partner with NEHAP as well. And there's a lot of program areas that are part of the NEHAP program. We have focus on diabetic eye disease, vision rehabilitation, vision and aging, glaucoma, and we have it both in Spanish and English. That are focused on our Hispanic, Latinx communities, and again, our new initiative, Eye Health, My Health program that we will be rolling out very shortly. So, I wasn't sure if you guys can write in the chat box, if you guys can hear me very well. I hope you guys are, but each of us, all of us probably on this call know someone that is older that may have lost their sight, right, or have visual compromise. And again, as I started off this presentation, just because you're growing up or becoming older doesn't mean that you have to lose your sight. We definitely may know someone in our family member that has eye disease that can impact their vision, such as glaucoma, or maybe they have diabetes that can lead to eye complication and they have visual compromise because of that. So today I'm going to spend the next 30 minutes, as I said earlier, just kind of addressing how we can prevent or slow down loss of vision from these conditions. As I mentioned, as we grow up, we're still beautiful, we're awesome, amazing, and I use the term growing up as opposed to getting older. What's interesting to note, recent stats is that our growing up population, our older population, our baby boomers is just becoming one of the biggest, largest segment of our population. You know, we have roughly 88 million people plus that are 65 years and older. But when you look at Americans age 40 who are visually impaired, that number is just increasing as well. We're going from 4 million to 7 million people plus that have visual impairment. And we really, as I said earlier, don't have to lose our sight or become visually impaired as we get older. There are steps and measures that we can do to prevent that. So vision loss and blindness are not part of normal aging, okay? But when it comes to older African Americans and eye health, our older population, there are some conditions that disproportionately impact that population of patient, right? So African Americans are at a higher risk for certain eye diseases. And usually these eye diseases and eye condition have no warning signs. So that's why we're focused on vision. Also, too, I just want to add that a lot of times these eye condition can indicate underlying systemic complication. A lot of patients may not be aware that they have high blood pressure, high cholesterol, and or diabetes, but an eye exam can detect that. Also, African Americans have some of the highest rates of vision loss and blindness caused by eye disease. And I know some of these factors are because of the social determinants of health, you know, access to health care. But there are resources, and we'll touch on some of the resources that are available for those that have limited access in getting eye care and eye health. And when it comes to the good news that I can say for this presentation is that with early detection and with treatment, you can prevent or protect your vision by having a comprehensive dilated eye exam. And also too, my goal today is just to educate you on some of these habits, knowing your risk factors and learning more on preventative measures against eye disease. So what are the common eye diseases that disproportionately impact minority communities? Let's see here. You have a couple of things in the chat box. Very good, thank you. So those eye diseases that disproportionately impact minority communities include what I call the silent killers, right? Glaucoma, the silent thief of vision, diabetic retinopathy, or having vision complication from diabetes and cataracts. Can you believe in 2022, we still have a large population of patients that have a significant cataracts that can lead to potential loss of vision. And I'll also touch on at the end of the presentation some of the complications that you can see with high blood pressure and high cholesterol, the silent killers as well. So let's talk about cataracts. It's a leading cause of vision loss worldwide, right? Outside of the United States, access to eye care and health care is not the same. And so you have patients that lose their vision as they grow up from cataracts. It's a normal aging process. It typically starts at 40 young, that you have these aging process where the lens get a little bit more cloudy. And when the lens in the eye, which is a structure in the eye, gets cloudy, it can lead to blurred vision, hazy vision, or a change in contrast. Things don't look as bright. They look more dull than they did years before. The other thing about cataracts that we're realizing when it comes to our African American Black community is that we're at an increased risk of developing cataracts, and not just cataracts, but blindness from cataracts. That risk is 1.5 times higher, almost 2 times higher than it is for our Caucasian counterparts. And not only that, having cataracts in the African American community, the Black community, also is more of a risk of developing blindness. Instead of getting the cataract surgery, these patients tend to lose their vision from cataracts. What we know from research is that African Americans are less likely to have cataract surgery. And also too, African Americans that do have surgery may have more of a complication associated with the surgery or associated with their systemic condition or underlying systemic conditions that they may have, whether they have, inflammatory disease, rheumatoid arthritis, their healing time is just not the same. There are some things that can lead to, patients getting cataracts, the medications that you're taking, steroid medication, during this era of COVID, the pandemic, a lot of patients that got COVID got this inflammation and had to be put on steroids, and that can lead to more of or earlier onset of cataracts. So if you know a family member that's taking steroid for inflammation, just know one of the side effects includes risk of developing cataracts. Also, if you have diabetes or high blood pressure, some of the medications from that can also lead to cataracts. Just having diabetes alone, you're 60% more likely to develop cataracts. Inflammation, collagen vascular disorders such as lupus, systemic lupus erythematosus, or sarcoidosis, or rheumatological disease like rheumatoid arthritis, with they disproportionately impact women, but they disproportionately impact minority women, specifically lupus and sarcoidosis. And so those patients, again, the inflammation plus they've taken anti-inflammatories like steroid, they're more at risk for developing cataracts. Eye injury, obesity, and that's another growing pandemic, I think, in our country. There's quite a few patients that are, slightly overweight or obese, and it's leading to other conditions such as diabetes and high blood pressure and high cholesterol. And then smoking, I always say smoking is that risk factor, can lead to earlier onset of cataracts and other vascular conditions. And of course, spending time outside without proper eye protection, UV protection, getting sunglasses that are cheap, don't have good UV protection. You need good UV protection in sunglasses. So a pair of Foster Grants or Ray-Ban have good UV protection. But we know that African Americans tend to have higher rates of cataracts. We know some of the risk of developing cataracts, but why are they not getting cataract surgery? I mean, we have the chat box if you want to just chime in and add some thoughts on why you think African American patients aren't getting cataract surgery more so than their Caucasian counterparts. I mean, one of the things that I think when I talk to my patients, it could be fear, right? Insurance, I see that. It costs too much. Those are definitely factors. And those factors are all in that social determinants of health, right? Education, knowing awareness of the condition, access to healthcare, neighborhood environment, social and community context, economic, someone brought up insurance. One of the most recent studies found that during the COVID pandemic, disproportionately minority communities lost insurance, although they were the frontline workers and suffered a little bit more from COVID-19 as far as death and other complications. But these social determinants of health are real, and other components of that include fear, trust. There's still this lack of trust of doctors. You tell a patient they need surgery. Maybe they may know someone who had cataract surgery and the complications may have occurred afterwards, and they're afraid to have cataract surgery. So fear is a cause, but is one of the reasons. But what I always try to tell my patients when they do express that fear is that you don't want to wait till the cataracts get really, really more challenging. Because as the cataracts become harder, more dense, the surgery becomes more complicated. And then it's more of a complication issue, a post-operative complication, if they wait too long to have the surgery. And also to access, one of the things I talk to my patients about, a lot of patients have insurance, they're not aware that the insurance will cover the cost of cataract surgery. And you don't have to have all of these newer types of cataract implants. You can have the regular typical cataract implant that most insurance will pay for and still at least get good vision, and you can improve your quality of life. I always like to leave a note with my patient. I talk about the latest cataract surgery technique, and that technique was developed by an awesome, amazing African American woman. And it's a really stitchless procedure. They go in with a little probe. And if you have that surgery early, you're more than likely to do much better when you have a phacoemulsification or as opposed to having a cut. And that's why I was saying before, if you wait too long or you have family members who are waiting too long to have the cataract surgery, then they're more likely to have a complication. The next condition that disproportionately impact African Americans is glaucoma, right? The silent thief of vision. It is the leading cause, or one of the leading cause of vision loss worldwide, second only to cataracts. It's a chronic disease. You don't go lose your vision immediately from glaucoma. It's a disease that is progressed over time, and in the end stage, when it has advanced so much, is when people lose their vision, or my patients lose their vision from glaucoma. In the US right now, there's about 4 million cases, 4 million people that have glaucoma. And that number is only expected to increase, or almost double, by 2050. And typically the disease impact patients that are 60 and over. But one of the things we know about glaucoma in our African American population, our Black population as they get older, is that it starts earlier. So an African American patient, it starts earlier, 10 years earlier, typically at the age of 40. So anyone that you know that's 40 years of age, 40 young, they should be having a comprehensive dilated eye exam, because this is the only way that we can detect glaucoma. And so it strikes earlier at age 40, but it also progresses faster. We're not sure why, but it tends to cause more visual field defect, more loss of vision earlier in African American patients. And glaucoma is about 5 times more common in the African American community, and blindness from glaucoma is 6 times more common. So Black patients, or African American patients, or older patients that are Black that have glaucoma have a higher risk of losing their vision. But the good news, there are drops. There are ways, laser surgery, regular glaucoma surgery, to prevent loss of vision from glaucoma. So again, if you have a friend, family member, or for you yourself, just think about, if you're age 40 and you're having an eye exam, ask about glaucoma screening. Make sure that they do the pressure check in your eyes. There are other risk factors for developing glaucoma. We're talking about nearsightedness. A lot of people during the pandemic are on Zoom doing a lot of near, and we're seeing an increased prevalence in myopia or nearsightedness. And the myopia, as the eyes stretch, can lead to potential loss of vision, and also can lead to the risk of developing glaucoma. Additionally, underlying systemic conditions such as diabetes. Patients that have diabetes are 40% more likely to develop glaucoma. So it's important for patients that have diabetes that they have a yearly comprehensive eye exam, but also ask about detection of glaucoma. How are their eye pressures? We talked about steroid use earlier, causing cataracts in our patients, but also too steroid use for those rheumatological diseases that I mentioned earlier: lupus, rheumatoid arthritis, sarcoidosis, any arthritic disease. These patients that use steroid, they're at a higher risk of developing glaucoma, because it can lead to higher pressures in the eye. And one of the key takeaway message from this talk is that if you know someone that has glaucoma, then the family members need to be checked, because family history is really important. The risk of glaucoma is 20% higher in families, right? So if your grandparent has it, you're more likely to get glaucoma. If your sister has glaucoma, it's important that you get checked for glaucoma. If your uncle has glaucoma, it's important that you get checked for glaucoma. So don't forget, family history is so important. Anyone in your family that has glaucoma, you're at risk for glaucoma as well. A key takeaway from glaucoma messaging is that 50% don't even know that they have the disease, while the other 50% that have it, they may not be as well controlled as they should be, right? But it's really scary that 50% of patients walking around with glaucoma don't know until the disease causes loss of vision. And by that time, it's too late, because the patient has advanced disease that has robbed them of their side vision. And that's how glaucoma works. It starts to impact your side vision, and then potentially it causes the center vision to be lost. And eventually the center vision will be lost. But it's when you start bumping into things, you can't see the car next to you as you're driving, that's when they start to realize that they have glaucoma. So it's important to get an eye exam to detect glaucoma. And can you see 20/20 and have good vision and still have glaucoma? A lot of time patients say, well, I see good. I have great vision. I don't need to see the doctor, and I don't need to use these expensive eye drops. My eyes aren't red and I see good. So can you be 2020 in the chat box? Yes or no? I just want to see some engagement here of what the audience think. Can you be 2020? And yes, I see some yeses there. Very good. Yes, of course. You can still see really, really good and have glaucoma because your center part of your vision is not impacted till the end of the disease. So vision is not a reason not to get an eye exam. An eye exam should be for the visual check, but also for the health of the eyes. And that's what we're talking about today, eye health, just to make sure you don't have glaucoma. So yes, you can still have glaucoma and be 2020. I call glaucoma the silent thief of sight because there are no early warning signs. And unfortunately, once you lose your vision from glaucoma, it's irreversible. You cannot get it back because it causes the nerve in the eyes to be damaged. And when you damage the nerve, it's permanent. And unfortunately, I see a lot of patients where they do have advanced glaucoma. And this is where it's really sad because for the patient, they're crying, it's impacting their quality of life, and unfortunately, the disease is irreversible. The good news is that for patients that do have complications for glaucoma, may have some limited sight, we have low vision or visual rehabilitation programs available where they can get magnifiers to assist them, large print to assist them in their daily activities of living so we can improve their quality of life. But eventually the disease will rob you totally of your vision and you're blind. So that's why early detection is so critically important. It not only just saves your sight, but it can definitely continue on the spectrum, improve your quality of life. It's a slow disease. We don't stop glaucoma, but we want to delay the progression of glaucoma in our patients. So if you know anyone, any family members, if you have friends that have never had an eye exam, or if you have your older friends that have glaucoma, then it's so important that they make sure that their family members get checked for glaucoma. And it's also important that they get checked and really follow the instructions to use the drop. One of the biggest challenges with glaucoma is compliance to the medication. Again, it's a symptomless disease. You don't have red eyes, you don't have painful eyes, but you have to use the eye drops to slow the disease down. All right. I'll take some questions at the very end. I'm going to go ahead and segue on to the next biggest complication or disease that we see in African-American population, our older African-American population, and that's diabetes. And I just wanted to provide the latest 2022 statistics on diabetes because this disease is not getting less, it's only increasing. And the COVID-19 pandemic has really shed light and also caused diabetes to increase. Over 37 million people now have diabetes. That's roughly 11% or more of the US population. What I want to take away from this message here is not how many people are diagnosed. They know they have the disease, but that there are about 8.5, roughly 9 million people walking around with diabetes, and they don't even know they have diabetes. They are not diagnosed. They have not been to a doctor, maybe again, fear, those social determinants of health, challenges, lack of insurance, but they know that they're at risk. They have family members that have diabetes. And so it's important that anyone that has family members that have diabetes, that they get checked. So that 9 million people that are undiagnosed are the ones that are really concerning because they could be walking around with bleeding or changes in the back of the eyes, and they don't even know that they have that. Another 96 million people in the United States have prediabetes. What is prediabetes? That's where your blood sugar level is a little high, but not high enough to be on medication. So when you go to the doctor and they tell you that you have prediabetes and to really use lifestyle modification or incorporate lifestyle modification, diet as a way to slow the progression, that is really something that you should do to make sure that you don't have the disease. And, when we think about 96, that's 1 in 3 individual. When we look at how many people are on this webinar, if we're in a classroom and we look to the left, look to the right, and there's 3 of us one of us will develop prediabetes. And again, another component of prediabetes and why that number is really high is, again, the food, access to quality foods in certain population of patients. Our African American patient population are in urban communities, so there's lack of good nutritional food. And just understanding food health and diet is really important when it comes to diabetes. When it comes to our Black African American population, our older population, diabetes affect roughly 12% of Black patients. 7.5% of non-Hispanic white, our Caucasian patients have diabetes, while 12% of Hispanic Americans have diabetes. When it comes to diabetes in the eye, so diabetes is one of those diseases, and I'll show you in the next slide. I always tell my students it impacts from the top of your head to the bottom of your feet, right? And everything in between. So diabetes can cause small blood vessel as well as large blood vessel changes. And the small blood vessel changes are changes that we see in the eye. And the term for eye condition is diabetic retinopathy. So almost 850,000 African Americans have some stage of diabetic retinopathy. And that number is only anticipated to increase and get worse. And I suspect that number is also higher because of the COVID pandemic and just a lack of insurance and patients not going to the doctor. So as I said earlier, diabetes impact all our patients from the top of the head to the bottom of their feet and in between. When we talk about diabetic retinopathy, it's a leading cause of blindness in working age adults. Those individuals 20 years to 74 young, right? And we're talking to older adults today that are probably 60, 70, 50, 40. So again, diabetes, and they are probably still working. So it's the leading cause of blindness in working age adults. The other thing that we know, diabetes, when it affects the eyes, it can also affect the kidneys. Did you know that diabetes is the leading cause of end-stage renal disease, or the number one reason why patients are on dialysis? It's because of diabetic nephropathy, the leading cause of end-stage renal disease. And it also causes changes in the way we perceive pain, or we could feel the bottom of our feet. So diabetes or diabetic neuropathy is diabetic nerve pain, not feeling things in the bottom of the feet. So these patients may have a little bit of gait ataxia, shuffling. Also too, if they get anything at the bottom of their feet, it doesn't heal that well, so they can have amputation. And then diabetes is the leading cause of non-traumatic lower extremity amputation. And it's not just your large blood vessel, but also, not your small blood vessel, but also your large blood vessel, right? So patients with diabetes are at an increased risk for heart attack, stroke, or any cardiovascular disease. When it comes to eye health, again, it can cause diabetic retinopathy, but I want to just leave the audience with the knowledge that patients with diabetes have dry eyes. So if your eyes feel sticky, it feels like there's something in the eye, that diabetes can also lead to drier eyes. Diabetes can lead to eyelid conditions where the eyelids are like, a little matted. So meibomian gland disease. Diabetes can lead to cataracts, as I mentioned earlier, glaucoma. Patients with diabetes are 40% more likely to have glaucoma. Also, too, diabetes can cause the blood vessels in the eyes to change. As these blood vessels change, they get weak, and when they get weak, they bleed. And so the term diabetic retinopathy is because there's bleeding in the retina from the disease. Can you have diabetic retinopathy before you're diagnosed with diabetes? I'm always asked that question. So let's see what the chat box says. Yes or no, just really quickly. Can you have, yes, I see some yes. Good, good, good. Yes, all right. Yes, for sure. You can have diabetic retinopathy before you're diagnosed. In fact, up to 33% of patients that are diagnosed with eye disease, it's at the time they're diagnosed with diabetes, right? So that's why the eye exam is so critically important, because not only are we detecting the presence of eye disease or seeing how your eye health is overall, but we're also getting the detection of the underlying systemic disease. You're walking around with diabetes. Some of the symptoms that these patients may have, besides just, bleeding in the back of the eye. And this picture just kind of illustrates diabetic retinopathy. You can have early bleeding, you can have severe bleeding, you can have these yellow precipitates in the back of the eye. As I said, there's leakage in the back of the eye. As I mentioned, 33% of patients with type 2 diabetes will have signs of bleeding in the back of the eye. But other symptoms could be fluctuating vision. Your vision is changing because your blood sugar level is too high. Patients with diabetes tend to have bags of glasses because they get new glasses because they can't see. So one of the ways that you can see if you're well controlled is if your sugar is too high, your vision will change and get fuzzy and be more blurry or fluctuate. This slide really just underscored what I said earlier about cataracts and glaucoma being associated with diabetes. So it's important for patients with diabetes to know a couple of things, how well they're controlled. I always talk to my patients about the ABCs of diabetes. The S isn't here, but it stands for smoking, right? If my patient has diabetes and they're smoking, I always educate them that they're at a higher risk of developing retinopathy or other eye complication. But the ABCs really stand for knowing your A1C level. What does that mean? Your hemoglobin A1C. Patients with diabetes, type 2 diabetes, tend to get tests for that hemoglobin A1C every 3 months. So I call it my 3-month blood test. It should be a number of 7 or less. The American Diabetes Association recommends 6.5. But patients should know their numbers. It should be 7 or less. It's not good enough to say, oh, you're well controlled. And patients say, well, the doctor said I was good. But what is good? You really should know the number. It should be 7 or less. Patients that have type 2 diabetes for over 10 years, and there's different types of diabetes, type 1, juvenile onset. These patients, they're on insulin from young age. They should be checked. Type 2 diabetes, if you have diabetes for 10 years, you're more at risk. Also, too, again, I mentioned earlier, at the time of diagnosis for up to 33% of patients with type 2, they will have some stage of retinopathy, potential bleeding in the back of the eyes. So if you have a family member who hasn't seen an eye doctor in 10 years and they have diabetes, they really should be seeing an eye doctor. If they have high cholesterol and blood pressure, right? They're more at risk of developing the retinopathy. So B is the blood pressure and C is the cholesterol. So what is the ABCs? Know your ABCs. Your A1C level, your hemoglobin A1C level should be 7 or less. Your blood pressure should be well controlled, close to 120/80 or less than 130/80 is really good control. Take your blood pressure medication if you have diabetes. If you have diabetes and you have cholesterol, take your cholesterol medication because it really does reduce your risk of developing diabetic retinopathy, the leading cause of blindness in working age adults. Also, another thing I want to point out that we're talking about maternal health, especially when it came to Black communities, Black women and maternal health. If you have or you know someone that have diabetes during pregnancy, or you may have had diabetes during pregnancy a long time ago, you're at a higher risk of developing type 2 diabetes. Patients are up to 40% more likely to develop type 2 within 5 years after pregnancy. So it's important if you had diabetes or pregnancy that you get an eye exam. You should get an eye exam during the pregnancy, but even after the pregnancy, you should get an eye exam as well. And then smoking, I can't forget the S. Patients that have diabetes and smoke are at a higher risk of developing complications. For the National Optometric Association, I just wanted to say we have our 3 Silent Killers initiative. This is focused on really educating patients, increasing awareness about glaucoma, diabetic eye disease, and high blood pressure. I can't leave without talking about high blood pressure because African American, especially our older Black community, tend to have high blood pressure. And it can impact the eyes, right? They're 40% more likely to have high blood pressure, 10% less likely to have it under control, and 3%, 3 times likely to die or have heart disease from high blood pressure. So you got to take your medication and you got to check your eyes, Why is blood pressure called the silent killer? Really quickly, it's because there are no symptoms. Sometimes my patients say, I take my medication when I feel my pressure. I don't understand. When you feel your pressure, you should have been taking your medication. When you have a headache from high blood pressure, it's too high. Also, too quickly to go back to diabetes, I just wanted to say a lot of times the patients will say to me that, I have a touch of sugar or I have borderline diabetes. What does that really mean? If you're on medication and you have borderline diabetes, you have diabetes. If you're on medication, metformin or other diabetic medication, you have diabetes. So those terms touch as sugar, borderline diabetes, they're important for me because I really want to make sure that I'm asking the patient, are they on medication? Because if they are, I really want my patients to know that they have the disease. I think a lot of times understanding the disease, accepting that they have the disease is the first step. And then the next step is be more compliant to the medication, more compliant to the treatment modalities that is recommended for them. And then following up, and of course, importantly, an eye exam, a dilated eye exam every year. I just wanted to show a couple of complications that can occur with blood pressure. When we say you have a stroke in the eye from blood pressure, sometimes it can cause those small blood vessels to rupture and bleed and cause sudden loss of vision. It can cause, severe sudden loss of vision, sometimes a permanent loss of vision. So these images here just kind of represent, you can get a blockage from cholesterol, like a cholesterol plaque, or even a blockage from blood pressure. And it can cause, a lack of blood flow. So you don't get bleeding, you just get lack of blood flow. Or you can get a blood vessel that breaks and you get a lot of bleeding in the back of the eye. Sometimes patients are walking around with bleeding in the back of the eye and they don't even know that they have the bleeding in the back of the eye from blood pressure. So one of the things I always tell my patients too is early signs of blood pressure we can detect in the eye exam. So a lot of times patients don't even know they have high blood pressure, but yet an eye exam can lead to the diagnosis of hypertension for these patients. So really quickly, what can you do? What can the patients do to preserve their sight, to preserve their vision, to delay the progression, and to prevent loss of vision? Is a couple of things, 10 things that I want to just leave you with. Number one is eat right to protect your sight. Why is that important? Studies after studies have shown that nutrition, good foods, healthy foods are really important for eye health. Foods that have lutein and zeaxanthin have been shown to really help kind of lessen or decrease the progression of eye disease. They increase blood flow to the back of the eye. So eating right really does protect your sight. So those healthy foods, a healthy diet, a diet where there's more vegetable, more green on the plate and less carbs and starchy foods and trans fat. So you want to definitely stay away from those unhealthy foods, the snacks, the potato chips. I know that a lot of us are working and we're busy, and even our older patients are busy and working, and fast food has become a mainstay in some household. But if we can cook and we can prepare our own meals, and that would be great for our sights as well, because spinach and kale and salads and fruits and vegetables really do have components that are eye health protective. Get moving, exercise. For patients with diabetes, a study found that if you exercise 30 minutes a day for three times a day, you can prevent getting full-blown diabetes. So if you have prediabetes, the 96 million people that have prediabetes, if you exercise, if you just move, cardiovascular, move, walk around the block. A lot of us have the watches that can give us our steps. If you take 10,000 steps a week, you can really improve your eye health. You can lessen oxidative damage and stress to the back of the eye. So get moving. Park further away at the store or the mall to walk in. You don't have to park so close. Those are little steps that patients can take. Even our older patients can take to move. There's some malls, in South Florida, we have a mall that's 2 miles long and it opens at 6 a.m. For patients to walk around the mall. So you can walk around this mall 2 miles in air condition just as exercise instead of being out in a hot heat if that's a concern. So get moving, do something, get exercise into your repertoire. Speak up if your vision changes. I'm always a proponent of educating the patient to talk to their doctor. If your doctor is rushed, you don't feel that you have an opportunity to talk to your doctor, then I always say get a new doctor, right? You have to be your best advocate for your eye care and your health care. So if you're not feeling well, if the medication it gave you and you're not feeling well with that medication, let your doctor know. If your vision is fluctuating, if you have loss of vision, let your doctor know. Also, to wear your glasses, and it's not just wearing the glasses have UV protection. So if you're prescribed glasses, and all glasses that are given by, offices have UV protection. You want to wear the glasses for UV protection. If you don't have a prescription, or you had cataract surgery, you want to get good pairs of sunglasses, Ray-Bans that have good UV protection to protect your eyes. Because even after cataract surgery, you don't want all that UV ray to damage the retina. So definitely wear your glasses, wear sunglasses, wear your shades. Keep germs away. I can't stress that enough as we talk about eye health. And a lot of times, if you know someone that has a red eye or quote unquote a pink eye, you might not want to be around that person that has a pink eye. Make sure you're not sharing towels with that person that has a pink eye, because you're susceptible, especially as you get older. Your immune system is not the same as a 22-year-old. So you may be readily more susceptible getting to viral conjunctivitis or red eye because you're around a young person that has a red eye. So make sure that you wash your hands when you touching or getting close to your eyes. And I would say that too with the whole COVID pandemic. One of the things that we saw with COVID is that it can impact the eyes, and it was COVID conjunctivitis. So really stress in washing your hands as much as you can before you touch your eye. Try not to touch your eye as much to prevent germs. Gear up. What I mean by gearing up is make sure you have your sunglasses, UV protection. If you're going to go out in the sun, make sure that you have, your hat on, your brim hat to lessen UV damage. Give your eyes a break. What does that mean, right? So if you're at the computer, which we found with 2020 and COVID-19, is there's a lot of up close eye fatigue, was really real computer vision syndrome. Even our older patients, in order to communicate with their family, they were on the computer doing FaceTime. And so there are a lot of eye fatigue and eye strain. So give your eyes a break, that 20-20 rule, right? So 20 minutes, look away 20 feet for 20 seconds. So, just give your eyes more of a break when you're on the computer. I said it earlier, and I really mean it. Smoking is one of those for me that, if I can get my patients to stop smoking, I do talk to them about smoking and eye health all the time. It not only causes irritation of the eyes, but it can increase your complications from diabetes, glaucoma, high blood pressure, and cause changes in the back of the eye. So smoking is one of those. If we can discontinue smoking, smoking cessation, it really helps protect the eyes. Talk about it. That's really important because family history is important. Friends and families are really important in making sure that our older adults get the, the health care that they need and the eye health care that they need. So if you have family members that have glaucoma and you don't know your family history, you don't know what's going on in the family, you should talk to your family members, make sure that, you're finding out they have glaucoma, diabetes, high blood pressure, and not only addressing the health component, taking the patient to the primary care physician, making sure that they get those visits, but also making sure that they go to the eye doctor. One of the latest treatment for patients that have diabetic retinopathy, if it's impacting the back of the eye and there's new blood vessels and the macula is swollen a little bit or they're swollen in the back of the eye, is injection in the eye. And a lot of times patients are just so afraid of having an injection in the eye. And so talking about it and their fears can help allay their fears. And for me as an eye doctor, I really talk to my patients about that it doesn't hurt. They do it once a month or every 2 months. And it really does improve their ability to see better once they get the injection, because the injection is causing less swelling. The injection is causing less blood vessel changes. So when I say talk about it, all aspect of eye health and eye care. So finally, live well, age well, and see well if we do all of that. But I can't leave without saying getting a regular eye exam. What I mean by regular eye exam is a yearly comprehensive eye exam. Every year to make sure your eye health, just like you would do your dental health, make sure it's a priority for you as you do your health checkup. And then also, I wanted to just touch on some resources because as I mentioned earlier, one of the challenges for our older American or Black American population is resources, right? Lack of insurance access, some barriers. So here are some resources from the NEI that you can get. You could doubly, I hope that you have the PowerPoint presentation, so you have these resources, but you can click on these links to get these low-cost eye care from the government, how you can get that. Eye condition and diseases to get a better understanding about the eye condition and diseases such as glaucoma, diabetic eye disease, high blood pressure changes, cataracts. So they're here for you, these resources, and we'll definitely share them with you as well. So now I'm going to open up the floor for any questions. I'm going to have Mike, Angela, and Angie assist me with any questions because I'm here for you to answer any questions that you have.
Dr. Reynolds, this is Angie. Thank you so much for an awesome and thoughtful presentation. We do have several questions in the chat, but I'd like to kick us off if I can and ask you if you can please define for us the difference between an ophthalmologist and an optometrist.
Sure, I definitely can do that. So an optometrist is an eye doctor that goes to optometry school. They get a 4-year degree. They can treat eye diseases. They can treat eye conditions. What we cannot do is surgery. So an ophthalmologist is a doctor that does surgery. They're generally an MD or a DO, a doctor of osteopathic medicine. And there's different types of ophthalmologists, right? So for patients that have diabetic retinopathy, those patients will be referred to a retinal specialist. For patients that have cataracts, then it's a cataract surgeon. For patients that have glaucoma, it's a glaucoma specialist. But of course, as an optometrist, we can treat those disease until they need that tertiary level of care. So there are more optometrists than there are ophthalmologists. And so I recommend patients get a yearly comprehensive eye exam by an optometrist. And if you are getting an eye exam and they're not dilating your eyes, because we do have new imaging devices that allow us to take image or photos of the retina. The images, photos are okay, but I also recommend that those doctors dilate as well, just to make sure that they are not missing anything in the photos. And so I'm a proponent of a dilated comprehensive eye exam in early detection of eye diseases. So that's the difference between an optometrist and an ophthalmologist.
Thank you. And before we jump into the chat, I just have one other question. How do we talk to our eye care provider? What types of questions should we ask annually after we've had an exam? How do we know that exam has been comprehensive?
So some of the questions that I really advocate my patients ask when they go and get an eye exam, it's not that, one, do I need new glasses? That's always the question, right? Do I need new glasses? Do I need to update my glasses? But I want you to ask about the pressure in your eyes. As I mentioned earlier, glaucoma is a silent thief of vision. Did you check me for glaucoma? How's my pressure? How's the nerve look in the back of the eyes? And if you have diabetes and they say everything is good, so you're not seeing any bleeding in the back of the eyes, right? So then they might come back and, oh, well, let's see early bleeding, well, what does that mean, early bleeding, right? So ask about the pressure, ask them what they're seeing on the retina. What do you see on the retina? Should I be concerned about my retina? Should I be concerned about my pressure? And then for those that have cataracts, again, in 2022, we still have a disproportionate number of African-American Black patients that are not having cataract surgery. So what is the fear? So I think the patients, I have cataracts, I know I should have surgery, but is there a point where it's too late to have this? Yes, when it's too hard, it's more of a complicated surgery. So for patients that have cataracts, each year you go, you might have a little bit of a visual compromise, but make sure you're asking, did it get worse? Is my cataracts worse? Because if it is getting worse, it's time for them to refer you. We don't want for it to be too bad, right? Can I wait another year for my cataract surgery? And are there other options if you don't have insurance? Most doctors do know resources, or they can get their patient information about resources to get the cataract surgery done earlier. So you want to ask your doctors about that as well.
Okay. Thank you very much for that. And looking at the chat, we have a question here that reads, what do eye drops do if you have glaucoma?
Oh, good. So the first treatment is the eye drop. You may be on one eye drop, you may be on two eye drop, you may be on different eye drops, right? So up to four eye drops or four different ways. So what glaucoma does is, what happens with glaucoma is that there's increased pressure in the eye. So the best analogy that I can give the audience is a bathtub of water. Your eye is constantly making a fluid, like the pipe is on, and it's called aqueous. And that aqueous is filling up this chamber. So the water is filling up the bathtub. Too much aqueous or too much fluid can lead to increased pressure in the eye, right? Or overflow of fluid in the bathtub. So the drops can either lessen the fluid, right? So one way the drops work is there's less fluid produced. Okay, so if there's less fluid produced, then the pressure is lower. The other way that the drops could work is it can help the drainage system. So if you have the water coming in the pipe from in the tub, and you have the tub and the drain is working, you have equal inflow, you have an equal outflow. So you don't get an overflow. But if the drainage is not working properly, then the drops may help to open up the drainage better so that it drains out the fluid, so you don't get a lot of fluid buildup in the eye and you get that high eye pressure. But I do want to leave the audience with the knowledge that eye pressure is just one of the risks. Some patients with low eye pressures are also at risk for glaucoma. So when you get your pressure checked, it should be less than 20. But I tell my patients that's important, but it's also the nerve health in the eye, because you can have a pressure of 15 and still have glaucomatous nerve damage in the back of the eye. But that's how the medication works. They either lessen the production of the fluid or increase the outflow of the fluid. Once those medication, and typically we do up to 2 to 3, maybe 4 medication maximal, then you may get laser surgery. Laser surgery works by opening up the drainage system to increase outflow of that fluid. And then some patients might even have, once the glaucoma advances, they can have more advanced surgery where they do other ways to decrease the fluid or to drain out the fluid. So the first step is the drops, and that's how the drops work. And that's why it's so important to be compliant to the drops, because you don't want to advance to get into other types of surgery because there's more complications with that.
Thank you very much. The next question reads, I have a friend who had cataract removal surgery, and now he's experiencing blurred vision. He was told he needed to have another surgery. That was over a month ago. Now he's reluctant to have the left eye surgery. Finding the best doctor for services is critical. Is there a link of surgeons available?
And there are a link of surgeon available. The National Optometric Association doesn't have that list. We're working on the list of ophthalmologists, but what I will advocate for that person's friend, because that is always a challenge, right? If you have complications from the first surgery, so typically cataract surgery is done one eye at a time. So they do the worst seen eye first. And again, there could be some subtle complication, or maybe the blurred vision is because he needs glasses after the cataract surgery. A lot of patients may need a little bit of a prescription after the surgery. However, if there are some changes in the back of the eyes, you could have either injections from fluid buildup in the back of the eyes. But if he needs a laser procedure, my father had cataract surgery, and a month after, 2 months after his surgery, he developed a little bit more blur. And so he developed a little secondary haze, and it's a quick procedure. It's not a big surgery. You go in and you do a little bit of a laser to open up that area that's hazy. And it's called a secondary sort of procedure. It's really simple, really easy. So it sounds to me that's what he needs. And if that's the case, it's just a little bit of a YAG procedure where they sit, you go in and you don't have to be anesthetized. You're asleep, you're awake, you're going for the eye exam. They do it right at that slit lamp, that device where you put your chin in, and then you're done. It takes maybe 2 minutes, 3 minutes to do the laser, and then you're done. So it sounds like that's what he needs. And I would advocate that he ask his doctor what exactly he needs, because that fear is precluding him from getting the other eye. And if he doesn't get the other eye done, then that cataracts get more and more, and he can lose his vision in that eye. So that has always been the challenge I find when I have patients that have a little bit of a complication from the first surgery. There is this fear that the other eye may have that complication. But really talk to his doctor, speak up and ask and just say what type of surgery. If it's a laser, then it's a simple laser procedure is what he needs.
Thank you. The next question reads, my doctor has recommended putting in stents because of glaucoma. What does this do for the vision?
So again, okay. So when we talk about stents for the glaucoma, there's two types of stents. One is a newest procedure, minimally invasive glaucoma surgery, where during cataract surgery, they put in this stent, and a stent is like a drainage tube, right? So this, like, if you think about it, it's a small microscopic drainage tube, and it helps to drain the fluid out of the eye better. So it helps to lower the pressure, therefore you're slowing down the progression of glaucoma. What does that do for your sight? It preserves what you have, right? And hopefully we're slowing down the damage. Some patients may need a bigger stent. So they have advanced glaucoma, they have severe glaucoma. So we really have to do a more invasive procedure. And if that's the case, then it's a bigger tube that they do to help drain the fluid out of the eye. And again, what does that do for your sight? It's really preserving what you have, making sure that you don't go blind from this disease. And so if your glaucoma specialist is recommending that, then I would definitely consider that procedure to save your sight.
Thank you, Dr. Reynolds. And you mentioned, gave us the guidance of moving away from our computers. And that's a great segue into the next question. Are there any other eye exercises that we can do to benefit ourselves besides, or in addition to moving away from our computers?
So taking the break from the computers, taking a break from near tasks is not just computers. You can't read a book for 3 hours. So taking more frequent eye breaks definitely help your visual system. Eating healthy definitely helps your visual system. And the reason you're taking a break isn't for the visual system and the focusing, but also we don't blink properly when we're on the computer. We're afraid we're going to miss something. So we're seeing eye fatigue and strain in young people as well, not just our older adults. So taking a break, if you have dry eyes and you're on a computer, you should be using your lubricating drops a little bit more as well, because your eyes aren't getting the evaporative need that it needs because you're not blinking properly. So you need to blink properly as well when you're on a computer. So those things, using the eye drops, taking the breaks from the computer definitely help, and eating healthy. I can't stress that enough. Now there are some newer computer glasses that have filters. They have these computer that lessens the blue light damage from the computer screen that some patients get, call them blue blockers. Those are also good if you're on computers quite a bit. You could talk to your doctor about getting those, added to your glasses if you're on computer a lot.
And just to follow up on that, does the same guidance apply to our cell phones?
Yes, let me do computers, iPads, cell phone, any digital device. We live in a world now where this phone is a computer, our iPad is a computer. I mean, kids as young as 6 months, no, not even 3 months are on a computer, which is a phone. So anything where you're doing a lot of near tasks, you're on social media quite a bit. Take more breaks.
Okay. And it looks like we have time for maybe 1 or 2 more questions. So I'd like to ask, can you speak to Medicare, Medicaid, and private insurance? Does Medicare, Medicaid, and private insurance pay for our annual eye exam, glasses, frames, and is that a guarantee for us when getting eye care?
You want to check with your insurance, but typically Medicare does pay for our eye exam visits. And I think you get 1 pair of glasses with Medicare after cataract surgery, but don't quote me on that. We'll check that. However, most Medicare have a secondary insurance, right? So my dad had Medicare, but he had Aetna Medicare, or you have United Health Medicare, or you have it attached to something. And the second company usually has part of their overall wellness yearly comprehensive eye exam. So then if you have Aetna Medicare, United Medicare, then glasses and the eye exam would be covered with that secondary component. Medicaid, same thing. If you have Medicaid, it does cover comprehensive eye exam and it does cover glasses. But of course, I always advocate the patient check their benefits as well. And most private insurance definitely provide eye exam as well as glasses as part of their, for me, I have Blue Cross Blue Shield, but I have iMed for my component of eye health and my glasses. So that was I elected to have that as part of my Blue Cross Blue Shield coverage. HMOs, same thing. They do cover comprehensive eye exams and glasses. Usually the HMO, you have to go to the doctor that's on the panel list to make sure that the coverage is covered. If you go out of the network, then it may not be covered for the patient. So I always advocate for the patients with insurances to check their eligibility and to check their benefits. Make sure you know your benefits. You should be eligible for a comprehensive eye exam or a contact lens exam and glasses to a certain percentage. So it wouldn't be fully covered, but there's portions of the glasses that would be covered. So the frame may be covered up to 40%. So they may give you benefits of $200 towards a frame. And then the lenses, they give you benefit towards a frame. So I don't want the audience to think it's fully covered and there's no out-of-pocket expense. So you just want to check your benefits to see what you have.
Okay. And Dr. Reynolds, we are exactly at 2:00 and would like to respect your time. We have one final question in the chat. Is it okay to share with you?
Sure.
Okay. So the last question reads, can you please speak to allergens and their impact on our eyes?
So when you say allergens, that term really means, patients that have allergies and they have these allergens in the air, getting the eye, and they can cause, the eyes to itch, the eyes to water, things of that nature. So when we say allergies and patients have allergies and they're allergic to dust, they're allergic to ragweed, or dander or pollen, it's those allergen that gets in the eye and it kind of stimulates a reaction, a cascade of the itching, burning, watery eye and red eye sometimes from allergies. And so using eye drops for allergies such as Patidare or over-the-counter Zatador helps to decrease the eye reaction or the cell reaction to those allergens. When we talk about pathogens, again, with COVID-19, viruses gets in the eye, they can cause a conjunctivitis as well, and bacteria gets in the eye and it can cause a conjunctivitis as well. So, red irritated eyes could be because of allergies and those allergens, and taking drops helps to control that reaction. Pathogens such as viruses and bacteria can also cause problems and you may need to be on medication to treat that, antiviral or antibacterial. That's why we recommend that you wash your hands, try not to touch your eyes with dirty fingernails, even with those fake nails that a lot of my older population has. They like to go to the spa and get these nice nails. Try not to touch your eyes with these long nails because you can get different things like fungus and bacteria in the eye. So you want to wash your hands.
Dr. Reynolds, this has been awesome. Thank you. Thank you very much for joining us this afternoon. I certainly have some questions to ask my ophthalmologist when I visit this year. So thank you very much. We hope you will consider joining us again to teach us more about eye health. And to our audience, thank you for joining us this afternoon. We give you back your day.
Thank you for having me, and thank you everyone for listening.
Thank you.
Thank you.
Good afternoon.
Thank you.